Welcome back to MedMind.
We have got 44 questions about rheumatism. You will get 1 point for every correct answer. Let's see if you can get a perfect 44. Acute rheumatic fever, ARF, is a post-infectious complication of group A streptococcal infection. ARF is a systemic inflammatory disease that primarily localizes in the respiratory system. The prevailing age for the onset of ARF is between 5 and 15 years. ARF is the most common cause of acquired heart disease in childhood and adolescence. The disease is characterized by a recurrent and progressive course. ARF typically develops 2 to 3 weeks after an episode of streptococcal pharyngitis. The etiological factor of ARF is alpha-hemolytic Streptococcus. Streptococcal antigens may cross-react with cardiac myosin and sarcolemmal membrane proteins. The inflammation in ARF is limited strictly to the heart valves. Formation of circulating immune complexes, CIC, is a key step in the pathogenesis of rheumatism. Autoantibodies to the myocardium are formed during the progression of the disease. Histologically, fibrinoid degeneration is observed in the collagen of connective tissues. Aschoff nodules are pathognomonic and can occur in any organ of the body. Aschoff nodules consist of multinucleated giant cells surrounded by macrophages and T lymphocytes. Aschoff nodules are visible immediately during the acute onset of the disease. Fibrinoid necrosis is the final, irreversible stage of the rheumatic cycle. The third stage of the rheumatic process is the formation of Aschoff-Talaleevsky granulomas. The entire cycle duration for these 4 pathological stages is approximately 6 months. Arthritis occurs in approximately 75% of patients with ARF. The arthritis in ARF is typically a migrating polyarthritis. Chorea is one of the major manifestations of rheumatic fever. Erythema marginatum is a type of neurological change. Subcutaneous nodules are considered a major diagnostic criterion. Carditis is a minor manifestation of ARF. Fever and arthralgia are classified as minor criteria in the Jones system. Leukocytosis is a major clinical feature of rheumatism. A prolonged PR interval on an ECG is a minor criterion for diagnosis. Raised ESR and C-reactive protein, CRP, are minor criteria. To diagnose ARF, you need evidence of a preceding streptococcal infection plus 2 major manifestations. A diagnosis can also be made with 1 major and 2 minor manifestations plus evidence of infection. Supporting evidence of infection includes a positive throat culture or raised antistreptolysin O, ASO, titer. Recent scarlet fever is considered supporting evidence of a preceding streptococcal infection. Mitral valve insufficiency, regurgitation, typically forms 6 months after the attack. Mitral stenosis usually develops within the first 3 months of the disease. Aortal defects generally develop even later than mitral defects. Rheumatic fever can lead to the development of chronic heart failure. Migrating polyarthritis primarily affects small joints like those in the fingers. Rheumatic chorea is also known as Sydenham's chorea or St. Vitus's dance. Anorexia and joint pain are common nonspecific clinical features. Antibodies produced against streptococcal antigens cause inflammation in the endocardium. Sclerosis is a reversible stage of the disease. The formation of valvular heart disease is a major feature of ARF progression. First-degree AV block is another term for a prolonged PR interval on an ECG. ARF is a post-infectious complication of streptococcal tonsillitis or pharyngitis. Comment down your answer. Also, don't forget to comment your total score out of 44. If you have any doubt, feel free to comment down.
I hope you enjoyed this video. If you do, please don't forget to like, comment and share this video. Also, don't forget to subscribe the channel and press the bell icon, so that you don't miss out the next video.